Hi, my name is Ilyanna Sudique.
Hello everyone, I am Desyril Naranja, and for today's we will be discussing heart disease. So what is heart disease? Heart disease is a condition that affects the structure or function of the heart. It is synonymous with cardiac disease but not with cardiovascular disease, which is any diseases of heart or blood. It is used narrowly and incorrectly as a synonym of coronary artery disease. About the disease. Heart disease is leading cause of death for men and women in the United States. About 1 in 5 heart attacks is silent. The damage is done but the person experiencing it not aware of it. About 18.2 million adults in the age of 20 and older have coronary artery disease. Etiology. Heart disease causes depend on specific type of heart disease. High blood pressure, high cholesterol, and smoking are the risk factor developing heart disease. Several other medication conditions can also put people at a higher risk of heart disease such as diabetes, obesity, unhealthy diet, physical inactivity, and excessive use of alcohol. Types of heart disease. Coronary artery disease. It is a blockage in the coronary artery disease, which is heart muscle don't get enough blood and oxygen. The disease usually starts as a result of sclerosis, a condition sometimes called hardening of arteries. Pericardial disease. It is an inflammation of any of the layer of pericardium. It is usually caused by infection with a virus, inflammatory diseases, which is lupus, rheumatoid arteries, or injury of the pericardium. Arrhythmia. It is an irregular heartbeat. It occurs when electrical signals that coordinate the heartbeats don't work properly. The faulty signaling causes the heartbeat to fast, to slow, or irregularly. Congestive heart failure. It is characterized by heart's inability to pump an inadequate supply of blood to the body. Acute heart failure. The symptoms appear suddenly but go away fairly quickly. It can occur after a heart attack. Chronic heart failure. Symptoms are continuous and don't improve over time. It is usually caused by coronary artery disease, a disorder that causes narrowing of the arteries that supply blood and oxygen to the heart. Valvular heart disease. It occurs when one or more of the heart valves do not work properly. It is characterized by either damage or defect. When it affects more than one heart valve, it is called multiple valvular heart disease. Stenosis. It when the valve opening becomes narrow and restrict blood flow. Prolapse is when a valve slips out of the place or valve flaps, leaflets do not close properly. Regurgitation. It when blood leaks backward through the valve, sometimes due to prolapse. It can develop before or at birth. Congenital causes or normal valves may become damaged during one's lifetime. Acquired causes. Congenital heart disease is a general term for a range of birth defects that affect the normal way of heart works. It occurs as a result of early developmental problem in heart structure. Heart valve defects. The valves inside the heart that direct blood flows may close up and leak. Valve wall defects. The natural walls that exist between the left and right side at the upper and lower chamber of the heart may not develop correctly, causing blood to back up into the heart or to build up in places where it doesn't belong. Blood vessel defects. The arteries and veins that carry blood to the heart and back out of the body may not function correctly and can reduce or block blood flow, leading to various health complications. Cardiomyopathy or heart muscle disease. It is a disease of the heart muscle that makes it harder of the heart to pump blood to the rest of the body. It can be a result of another condition acquired or inherited for one or both parents.
Manifestation. The signs and symptoms that you can get from coronary heart disease is chest pain, weakness, lightheadedness, nausea, or a cold sweat. You can get pain or discomfort in the shoulder or arms, and shortness of breath. In pericardial disease, you can get chest pain, cough, low-grade fever, swollen leg, fatigue, heart palpitation, shortness of breath, and abdominal swelling. In arrhythmia, you can get heart palpitation, tachycardia, which means rapid heartbeat, bradycardia, which means low heartbeat, chest pain, and shortness of breath. In congestive heart failure, you can get shortness of breath, nocturia, which means excessive urinations at night, heart palpitation, dry hacking cough, weight gain, abdominal swelling, loss of appetite, or nausea. In valvular heart disease, you can get chest pain, dizziness, fatigue, loss of consciousness, abdominal swelling, irregular heartbeat, shortness of breath, and heart murmur. In congenital heart disease, you can get cyanosis, fatigue, tachynetia, which means rapid breathing, tachycardia, which means rapid heartbeat, shortness of breath, fainting during physical exertion, swelling in legs, abdomen, and around the eyes. In cardiomyopathy, you can get shortness of breath, abnormal heartbeat, lightheadedness, heart murmur, dizziness, fainting during physical exertion, chest pain, swelling the eyes, ankles, feet, legs, abdomen, and veins in the neck. Diagnostic exam and procedure. In coronary heart disease, you can take electrocardiogram test. It records the electrical activity of the heart. Exercise stress test. It determines how well your heart functions when it is working the hardest. Pharmacologic stress test. You are given medication to increase your heart rate and mimic exercise. Coronary calcium scans. Measures the amount of calcium in the walls of your coronary arteries. Echocardiogram. Uses sound waves to see how well the structures of the heart are working and the overall functions of the heart. Blood test. It is ordered to see if there are factors that affect arteries. Cardiac catheterizations. Involves inserting small tubes into the blood vessel of the heart to evaluate heart functions. Other imaging may include nuclear imaging. It produces images of the heart after administering a radioactive tracer. Computed tomography angiogram uses CT and contrast dye to view 3D pictures of the moving heart and detect blockage in the coronary arteries. In pericardial disease, you can take chest X-ray. It can be used to see the size of the heart and any fluid in the lungs. Electrocardiogram, echocardiogram, cardiac MRI. It can be used to check for extra fluid in the pericardium. CT scan, cardiac catheterization, and blood test. In arrhythmia, you can take electrocardiogram, ambulatory monitors. These are devices that record the electrical activity in your heart that are used to detect heart rhythm problems over a longer period of time. Stress test, echocardiogram, cardiac catheterization, electrophysiology study, It is a special heart catheterization that evaluates your heart's electrical system, and it is used to find the cause of the abnormal rhythm and determine the best treatment for you. Tilt table test. It records your blood pressure and heart rate on a minute-by-minute basis while the table is tilted in a head-up position at different levels and may be used to evaluate heart rhythm, blood pressure, and sometimes other measurements as you change position. In congestive heart failure, you can take blood test, chest x-ray, electrocardiogram, echocardiography, exercise stress test, multi-gated acquisition scan. It is used to evaluate the pumping functions of the ventricles. Cardiac catheterization, magnetic resonance imaging. In valvular heart disease, physical examination may reveal fluids in the lungs, enlarged heart, or heart murmur. You can take echocardiogram, cardiac catheterization, and electrocardiogram. Other tests may include the transesophageal echocardiogram, exercise stress test, multi-gated acquisition scan, magnetic resonance imaging. In congenital heart disease may initially be suspected during a routine ultrasound scan of the baby in the womb. It is called total echocardiography, which will be carried out around 18 to 22 weeks of the pregnancy. It can also be some of the characteristic signs or symptoms of the baby, such as blue tints the skin or lips. And the baby heart will be checked as part of the newborn physical examination. Further testing may include echocardiogram, electrocardiogram, chest x-ray, pulse oximetry. It measures the amount of oxygen present in the blood. Cardiac catheterization. In cardiomyopathy, ambulatory monitor, cardiac CT, cardiac MRI, echocardiogram, electrocardiogram, exercise stress test, cardiac catheterization, and myocardial biopsy. It studies a small sample of your heart muscle tissue to look for cells changes.
Treatment. So for the treatment of coronary heart disease is a lifetime changes. Don't smoke, manage health problems, eat a heart-healthy diet, limit alcohol use, and increase your activity level. Medications. Medication to lower your cholesterol levels such as statins, bile acids, sequestrants, niacin, and fibrates. Medications to lower blood pressure such as beta blockers, calcium channel blockers, angiotensin converting enzyme inhibitors, or angiotensin 2 receptor blockers. Medication to stop angina such as NSAIDs, nitroglycerin, and ranolazine. Medications to reduce the risk of blood clots such as anticoagulants including aspirin and antiplatelets. Procedure and surgery. Balloon angioplasty and stenting. Restore blood flow to the heart. Coronary artery bypass graft surgery. Involves creating a new path for blood to flow when there is a blockage in the coronary arteries. Enhance external counterpulsation. This helps improve blood flow to the heart and helps create natural bypasses collateral circulation around blocked coronary arteries, and is possible treatment for those with chronic stable angina who can't have an invasive procedure or bypass surgery and don't get relief from medication. Pericardial disease. Medications. Treatment for acute pericarditis may include medication for pain and inflammation such as ibuprofen and aspirin. It may need an antibiotic and antifungal medication depending on the cause of pericarditis. If the symptoms are severe, last longer than 2 weeks, the symptoms return after being cleared up, the doctor can prescribe colchicine and anti-inflammatory drugs. Other treatment. Pericardiocentesis. If the fluid builds up in the pericardium and compresses the heart. Pericardial window. If the fluid cannot be drained with the pericardiocentesis procedure. Pericardiectomy. If the patient have constrictive pericarditis, they may need have some of their pericardium removed. Arrhythmia. Medications. Anti-arrhythmic drugs. These are used to convert arrhythmia in sinus rhythm or to prevent an arrhythmia. Heart rate control drugs. These are used to control the heart rate. Anticoagulant or antiplatelet therapy. These are used to reduce for risk of clot forming or having strokes. Medication used to treat related conditions that may be causing an abnormal heart rhythm. Invasive therapies. Electrical cardioversion. An electrical impulse is delivered through the chest wall that synchronizes the heart and allows the normal rhythm to restart. Catheter ablation. High-frequency electrical energy is delivered to a small tissue inside the heart and disconnect the pathway of the abnormal heart rhythm. Pulmonary vein insulation nor isolation. To create a ring or of scars to isolate the foci responsible for triggering atrial fibrillation. Devices. Permanent pacemaker is a device that sends small electrical impulses to the heart muscle to maintain a normal heart rate. Implantable cardioverter defibrillator. It defects a very fast abnormal heart rhythm. It delivers energy to heart muscle to cause the heart to beat in a normal rhythm again. Biventricular pacemaker and fibrillator. Cardiac resynchronization therapy or CRT. This device is used to synchronize the contraction of the left ventricle. Congenital heart failure. Stage A treatment. Physical activity treatment for high blood pressure and high cholesterol. No drinking of alcohol or using drugs. Stage B treatment. Beta blocker, aldosterone antagonist, and vasodilator medicine and beta blocker does not relieve your symptoms. Hydralazine nitrate combination if other treatment does not stop for medications. A diuretic if symptoms persist. Tracking your weight every day or tracking your weight every day. Possible fluid restriction. Possible cardiac resynchronization therapy. Possible implantable cardiac fibrillator therapy. Stage C treatment. Medication to slow your heart rate if your heart rate is faster than 70 beats per minute and you still have symptoms. Restriction of sodium salt in your diet. Tracking your weight every day. Possible fluid restriction. Possible cardiac resynchronization therapy. Possible implantable cardiac defibrillator. Stage D treatment. Heart transplant. Ventricular assist devices. Heart surgery. Continuous infusion of intravenous inotropic drug. Palliative or hospice care. Research therapies. Heart valve can be treated by protecting your valve from further damage, taking medications, having surgery and invasive procedure if necessary. Heart valve repair. It allows the surgeon to fix your faulty valve, often without the use of artificial parts. Heart valve replacement involves removing the old valve and sewing the new valve to the annulus of your old valve. Seeing your heart doctor for regular visits. Congenital heart disease. Surgical treatment. Closure devices. This used to close a defect or an opening between the right and left sides of heart. Robotically assisted patent foramen ovale repair. This is a type of minimally invasive heart surgery performed on a patent foramen ovale with an endoscopic closed chest approach. Robotically assisted atrial septal defect repair. This is a type of minimally invasive heart surgery performed on atrial septal defect (ASD) with an endoscopic closed chest approach. Cardiomyopathy. Medications. Heart medication can improve your blood flow, control symptoms, or treat underlying condition. You may take blood thinners such as warfarin, beta blockers such as propranolol, and medications to lower cholesterol. Devices to correct arrhythmia. Pacemaker or implantable cardioverter defibrillator. Treat irregular heart rhythms. These devices monitor your heartbeat. They send electrical impulses to your heart when the arrhythmia starts. Devices to improve blood flow. Some devices help your heart pumps blood more efficiently. Cardiac resynchronization therapy. Devices control the contraction between the left and right sides of the heart. Left ventricular assist device. Help your heart pump blood. Surgery. If you have severe symptoms or underlying heart condition, your provider may recommend your heart surgery, open heart surgery, or heart transplant when all other treatments have failed to bring relief. Nursing care or health teaching. The care plan necessary for heart disease focuses on promoting physical activities, reducing fatigue, relieving fluid overload symptoms, decreasing anxiety, increasing the patient's ability to manage anxiety, encouraging the patient to verbalize his or her ability to make decisions and influence outcome, teaching the patient about self-care program. Nursing intervention. Promoting activity tolerance. A total of 30 minutes of physical activity every day should be encouraged, and the nurse and the physician should collaborate to develop a schedule that promotes pacing and prioritization of activities. Managing fluid volume. The patient's fluid status should be monitored closely, auscultating the lungs, monitoring daily body weight, and assisting the patient to adhere the lower sodium diet. Controlling anxiety. When the patient exhibits anxiety, the nurse should promoting physical comfort and provide psychological support and begin teaching ways to control anxiety and avoid anxiety-provoking situations. Minimizing powerlessness. Encourage the patient to verbalize their concern and provide the patient with decision-making opportunities. Nursing priorities. Improve myocardial contractility, systemic perfusion. Reduce fluid volume overload. Prevent complication. Provide information about disease, prognosis, therapy, and prevention of recurrences. That's all.